The Peptide Files, Episode 3, The GLP Takeover, How Big Pharma Hijacked Your Appetite and Called It Healthcare. It started with a shot, a weekly injection that promised to silence cravings, melt belly fat, and make you forget that you ever stopped at Taco Bell for late-night nachos. But behind the rapid weight loss, celebrity endorsements, and TikTok transformations, something strange was happening. People were losing muscle. Some claimed that their stomachs were literally shutting down, and they didn't seem all that interested in, well, anything anymore. I'm Dr. Kristen Lindgren, and welcome back to the Peptide Files. Today we're diving back into the world of GLP-1 receptor agonists, or GLP-1s, a topic that remains as hot today in headline news as it did when it hit the market years ago. These are peptides, but manufactured just differently enough that they can be patented as drugs. Drugs that turn your metabolism into a subscription service, making billions of dollars for the pharmaceutical industry. Let's get into it. I've talked about this before, but let's go over it again. What is a GLP-1? GLP-1 stands for glucagon-like peptide 1, a hormone your gut naturally releases after you eat something. It's part of a brilliantly designed system engineered to slow down how fast your stomach empties, tells your pancreas to secrete insulin, lower blood sugar, make you feel full faster, ultimately improve insulin sensitivity. In other words, it's one of the many hormones that help regulate metabolism in a balanced, intelligent, God-given system. But behind the veil of mimicking nature, pharma saw an opportunity. Because when people started injecting synthetic versions of this hormone, their appetites plummeted. And so did their weight. And thus began the Ozempic era. The mean girls of metabolic medicine. Ozempic, also known as Wegovy or semaglutide, was basically first on the scene. And suddenly everyone from Hollywood elites to your cousin Becky was losing 30 pounds in 3 months. No gym, no kale smoothies, just a once-weekly injection. But pharma wasn't about to stop there. If hijacking one satiety hormone could rake in billions, might there be others? Of course. Let's meet the current cast of the GLP-1 characters and their hormone sidekicks. Semaglutide, also known as Ozempic or Wegovy. This is the OG GLP-1 receptor agonist. Semaglutide is just the one peptide, GLP-1. It wasn't the first in this class, but it was and still is the strongest. It slows digestion, improves insulin signaling, and suppresses appetite. Average weight loss was 15% in clinical trials, and the side effects are all the ones the press is screaming about. Nausea, vomiting, gastroparesis, that's slowing down of the stomach emptying, emotional numbing, and yes, muscle loss. Tirzepatide, also known as Mounjaro or Zepbound. This is a dual agonist, meaning it contains 2 different peptides, both made by your gut. GLP-1 plus GIP or glucose-dependent insulinotropic polypeptide. Don't make me say that again. This is like semaglutide's bigger, bolder, more aggressive cousin. Average weight loss was a staggering 21% in clinical trials. That eclipses bariatric surgery for many patients. Same side effects. Higher risk of lost lean muscle mass without proper support. Retatrutide, still in clinical trials. Eli Lilly still has this in clinical trials, but I may have seen it available like over a year ago already from research pharmacies. Retatrutide is no doubt the overachiever of the group, combining GLP-1, GIP, and a third G called glucagon receptor agonist, another peptide made by your gut. That peptide throws a few more questions into the mix. We have a pretty good understanding of the activities GLP-1 and GIP have in the body in the short and long term, but not so much when it comes to constant glucagon activation. What impact might this have on other organs in the endocrine system, like the adrenals and thyroid? What about long term metabolic flexibility? Lily is still working out the kinks on this, but don't think for a second that will keep this drug from officially coming to the market. Early clinical trial data demonstrates up to 24.2% weight loss with retatrutide. Seriously, that's like chopping off your entire left leg and half of your right. Cagrilintide, very early stage clinical trials. So this is exciting or horrifying. Cagrilintide, or CAG as it goes by in biohacking zones, is a synthetic amylin analog. That's a peptide made by your pancreas meant to mimic another naturally occurring satiety hormone. Amylin enhances this slow gastric emptying situation. If you never want to eat or feel a survival emotion called hunger ever again, CAG is here for you. CAG isn't all that remarkable by itself, but pharma's real play here is combining it with the GLP-1s. You thought Sharon Osbourne looked horrifying from Ozempic? Imagine our outcomes with CAG on board. Like retatrutide, CAG isn't officially on the market yet, but like retatrutide, back-channel peptide compounders are already compounding and selling it for research. The pros: enhanced appetite suppression and potentially greater weight loss. The cons: unknown safety, synergistic side effects, and even higher risk of creating metabolic dependency. So to recap, we've gone from targeting one hunger hormone to two, three, maybe four, all layered together to take overweight Americans from looking like this to this. Don't get me wrong, I'm a fan of the GLPs in the right hands with the right supervision, but that's not what's happening here. If your regular doctor is smart enough to realize he or she doesn't know the first thing about these medications and refuses to write a script, you can just get online, sign up for a subscription service. These drugs can be shipped right to your front door without ever seeing a doctor, ever standing on a scale, ever having your labs checked, your body composition monitored, ever. The stack hack. Now, here's something you didn't hear from me, but it's making the rounds in the biohacking world, so we're going to talk about it because not talking about it doesn't make it go away, like ever. There's a growing number of people online who are combining multiple GLP-1 receptor agonists, sometimes in lower doses, adding small doses of CAG to their semaglutide, tirzepatide, or retatrutide regimens, and even tinkering with other non-FDA approved peptides in DIY-style weight loss stacks. The theory? Stacking at subtherapeutic doses might provide similar weight loss benefits with fewer side effects, kind of like a microdosed metabolic stack. The reality? Well, we don't really know. There are no safety studies, no long-term data, and no regulation. Just people experimenting on themselves with peptides purchased from gray market suppliers who may or may not be making them in their basement next to bath salts. Just saying. Listen, I get it. People are desperate for solutions, and some of those folks have a good handle on physiology and how these things work. But when you start mixing powerful hormones that affect insulin, satiety, dopamine, and digestion at the direction of the same guy at the gym selling bootlegged steroids, I would personally seek more reputable counsel. So while I'm telling you this exists, I'm also telling you don't try this on your own. Side effects may include everything you didn't sign up for. Do these peptides work for weight loss and potentially improve long-term insulin sensitivity? Yes, but the mainstream narrative tends to leave out some important side effects we should be mindful of. Muscle loss. Up to 40% of the weight loss isn't fat, it's lean tissue. Not exactly what you want when you're trying to boost metabolism. Gastroparesis. In some people, the stomach literally stops functioning. This does not happen often, but it can happen. And no, it doesn't always recover. Emotional blunting. Appetite is gone, but so is joy. People describe feeling flat, numb, disinterested, even depressed. This is a relatively newly recognized side effect. I've had patients report feeling absolutely great on GLP-1s. Energy is better, the food noise is gone, but for some people, they apparently just stop feeling anything at all. Rebound weight loss. For most people, if they stop taking the drug, the weight almost always comes back, sometimes with a vengeance. Why is this? Well, if you go back to eating the same crap you were eating before, are we supposed to be shocked by this? These medications used to be tools for people with type 2 diabetes, but times have changed. The majority of users now are non-obese, non-diabetics looking for cosmetic weight loss. Oh, and kids. Did I mention the kids? Semaglutide is FDA approved for use in children as young as 12 for weight loss. What happens to a person started on a once weekly shot to control weight and metabolic dysfunction at the age of 12, 10 years from now? What about 20? Meh, I guess we'll find out then. This stuff rewires your brain. This isn't just about your gut. GLP-1 agonists cross the blood-brain barrier and affect dopamine, reward, and behavior. That means reduced food cravings, decreased interest in alcohol, cigarettes, and even compulsive behaviors. I think we can all agree that those are good things. But now that these peptides have been on the market for this long and so many people are using them, we're seeing some reports of not so great brain activity, diminished joy, apathy, and personality changes. When hunger disappears, what else goes with it? Follow the money. If you're wondering why you're seeing commercials for Ozempic every 8 seconds, here's why. Semaglutide alone is expected to rake in $18 billion this year. Tirzepatide will likely become the highest grossing drug of all time. GLP-1s are the new Lipitor, and obesity is the new cholesterol. This is great news for pharma shareholders. Maybe not so great news for patients who are being told this is a long-term solution instead of a short-term tool to shed some unwanted pounds and improve insulin resistance. These drugs alone don't fix the problem. If significant diet and lifestyle changes aren't implemented at the same time, these peptides basically rent control over your metabolism. The minute you stop paying, the benefits vanish. And just when you thought pharma's mad scientists couldn't get any crazier, enter orforglipron. Enter orforglipron. Orforglipron. Oh my gosh. But wait, there's more. Meet orforglipron. Here comes the next act. Orforglipron, catchy, right? Rolls right off the tongue, is Eli Lilly's brand new oral GLP-1 receptor agonist. But this time, it's not even a peptide. They're done with the it's something your body makes anyway angle. This drug, don't make me say it again, is a small molecule drug designed to mimic the effects of GLP-1. Why does this matter? Well, now they can put GLP-1 agonists into a pill, or something like that. For all of you needlephobes out there, that means no more injections, no more pens, no cold chain shipping headaches, just a once daily pop and go tablet for your permanent appetite suppression. It's not FDA approved yet, but trust me, it's coming. It's coming fast. Oh, and better yet, they're also already working on combo drugs, blending orforglipron with other appetite regulating hormones like amylin analogs, think CAG, to create multi pathway oral weight loss cocktails. Welcome to the future, friends. Real solutions. The truth is, you don't have to play hormone roulette to lose weight or reverse insulin resistance. These peptides certainly help, but don't believe the media spin that you can't do it without them. Here's what naturally supports your GLP-1 pathway without the expensive prescription. Berberine. This is a naturally occurring extract from Oregon grapes. It naturally boosts GLP-1 and insulin sensitivity. Time-restricted eating or intermittent fasting enhances GLP-1 and improves leptin sensitivity. Protein-rich meals stimulate endogenous GLP-1. Strength training preserves lean muscle mass and improves insulin signaling. Sleep, stress reduction, microbiome care. Yes, those things still matter. Weight loss isn't just about less hunger. It's about better signaling, stronger mitochondria, and a metabolism that actually works. Final thoughts. Miracle molecule or metabolic misdirection. GLP-1 drugs are powerful for sure. For some people, they're genuinely helpful and in the right hands can not only improve numbers on the scale, but reduce risk associated with all things related to insulin resistance and metabolic syndrome. But there's no easy button. Diet and lifestyle changes need to happen for there to be any long-term benefit. Body composition and labs need to be monitored to make sure you don't get Ozempic butt or osteoporosis or go bald. When Big Pharma suddenly becomes this interested in anything, you should pause and ask yourself, who benefits? Who profits? Their plan isn't for you to use these peptides like we do as a tool to get back on track. I can guarantee their business model is to start these drugs as early as possible for as many indications as possible and market them for lifelong management. There's no money in wellness, people. Big medicine is big business. That'll do it for me. This is Dr. Kristen Lindgren signing off from the Peptide Files. If you learned anything in this episode or found it interesting, please like the video, subscribe to the channel, leave a comment, or share it with a friend. I know it's annoying when people beg for compliments, but those things really help us out. If you or someone you know is struggling with weight loss or downstream health issues related to metabolic dysfunction like heart disease or high blood pressure, please give our office a call to schedule a consult or visit us at lindgren.health. I took the masterclass in peptides. Promise I can give you better guidance than that guy at the gym. No disrespect to him or his bath salts. Thanks for watching, everyone. Until next time, stay skeptical, inject nothing blindly, and continue to educate yourself and be involved in your own healthcare. I'll see you for the next one. Bye for now.